Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to this week's edition of Humanity First. In the second part of the program, we're going to be having a really good conversation about addiction and where we are as a treatment provider community, but also as a culture in terms of how we've moved along with how we see addiction, and in fact, how we see it as a disease, not a life choice, but also about some of the stigma that still exists in our society and the difficulties that some people have with getting treatment. And we'll be chatting with Jeff Wing and Mike Kelly, who work at our Plymouth and Brockton COPE programs, which is our community outreach prevention education program that works in a harm reduction capacity with individuals who are in the throes of addiction. And some of the work they do is absolutely amazing in terms of turning people's lives around. So we'll hear some stories and some very personal stories as well from them. But I suppose this week would be odd if we didn't mention yet another mass casualty situation at the Super Bowl celebration in Kansas City. It is once again a situation where we all shake our heads and say, how could this possibly happen? This was such a happy occasion, and yet somebody has used a gun to indiscriminately kill people and wound a whole bunch of kids, as I recall. I'm not going to talk about gun control. I'm not going to talk about what we should be doing legislatively, but I think what we should be doing is a little bit of soul searching around the access that people have to guns. And also, I mean, it is often the case that both sides argue this isn't about mental health, this is about gun control, this isn't about gun control, it's about mental health. It would be foolish to acknowledge that it wasn't about both of those things, and as a society, how we come up with a solution to this. And I think the only solution really is to get together and think about a public health policy for behavioral health, which acknowledges the stresses that people are under in society and educates people around the signs and symptoms of people who might be a danger to themselves and others. And we pay little attention to that. The National Council of Mental Wellness do a wonderful intervention called Mental Health First Aid. There is a small piece on addiction in that. We need to do more of that. We need to not keep the secrets of behavioral health to the professional and lived experience community. This should be something that we're all paying attention to, because it is really touching the lives of everybody. And our TV screens, unfortunately, are filled with these tragedies time and time again. And it just turns into a political football between the left and the right, which is never, ever going to be a solution to this problem. A public health strategy is the only way out of this. We'll be right back.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse, and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
And welcome back, everybody, to Humanity First. And as was promised in the first half of the show, we have a couple of guests who I have been waiting with anticipation to chat to, because they are two members of staff at BAMSI who do some unbelievably important work. And we've talked long and in depth about the issue of addiction in America, which in some ways is a political issue, is a medical issue, is a psychiatric issue, is an issue which I think if I said to the audience now, put your hand up if you have never been affected by the disease of addiction in your family, there wouldn't be many hands that went up. And I've seen that in conferences all over the place. So, there is an irony that many people try to put some distance between the disease of addiction and themselves, when in fact it is so close to all of us. But let's talk to a couple of people who know that story very well. We have Mike Kelly, who is the program manager of our COPE program at BAMSI from Brockton. Hi, Mike. Nice to see you.
How's everybody? Michael from Plymouth COPE.
Sorry, Plymouth COPE. Yeah, that's right.
That's all right.
And Jeff Wing, who is our community nurse, a public health nurse. So Jeff, welcome aboard, and also from Plymouth COPE. Let me just get that right.
Brockton.
And Brockton. But I believe we're speaking to you from Plymouth today. Is that right?
Yes. Live from Plymouth.
So, maybe we can start with a little description of our COPE program, which is, as you've just heard, in 2 different places. And it is a program that provides education and intervention in those 2 areas. What does COPE stand for, Michael?
Well, the acronym is Community Outreach, Prevention, and Education. And Plymouth COPE is the newer segment. We are sort of like the sister program of the Brockton COPE that's been established for many years. Our services are similar, but the populations we are targeting are a little bit different. Brockton being a very urban environment, and Plymouth being like a rural beach town. So different populations, same issues, same needs, I like to put it as, and you can see the parallels when people are sort of suffering. You can't, doesn't matter what town you're in at that point. So we're trying to provide those services for both communities, the Brockton community and the Plymouth community and the surrounding towns.
Yeah, I think about the history of how America and my country, Britain, has faced the issue of the disease of addiction. And it's been a really interesting public health story, if you ask me. And I say that really because I mentioned in the first section, we were talking about the atrocities that happened in Kansas City, but with the shootings, that there are different public health approaches to issues like this, and people want to avoid them oftentimes, and so it becomes a public safety issue often when we talk about addiction. In the same way, I think that we talk about mental health and gun violence. But in terms of what you're seeing and what your program is seeing, it's a little bit different, in my opinion, from the way in which we've addressed the disease in the past. And that is, and I remember when I was a clinician first off, and I was working in the community, and I was essentially a behavioral health, a mental health clinician who came to learn about addiction subsequently. But people would come to our clinic and they'd say, I'm drinking an awful lot, and I'm depressed. And the typical response to that would be, well, why don't you go away and get yourself sober and then come back and I'll treat your depression. And that's almost a comedy sketch in the way that we look at treatment now. And we're moving more and more into a world where we're accepting this notion, should I say, of harm reduction, of meeting people where they are. And really, I would say that COPE is the sort of living embodiment of that. It is controversial, but can you just, Jeff, maybe give us a little thumbnail sketch of what our interventions are with people from a harm reduction perspective?
Well, as you said, we meet people where they're at. We provide a judgment-free zone. If someone's ready to enter treatment, we can help them find a facility for them to go to. At the same time, if someone's not ready for treatment and they're looking for clean syringes or clean pipes or anything that they will require to use their substance of choice, that we will try to help them maintain and be as healthy as possible as they're making their own decisions.
So that's a huge difference from what I described as a young clinician 30 years ago or whatever it was. Let me put this to you, because I think there is some conventional wisdom out there that says, and I hear it sometimes. For instance, when I was in Boston, I responded to a scene where Narcan had been administered, and the firefighters were pretty annoyed, and they said, this is the 5th time we've given Narcan to this person this week. What's the point? There's a lot of that around. It's certainly not something I subscribe to, because this is a way of intervening and saving someone's life. But what do you say to the skeptics around harm reduction? So all you're doing is just encouraging people, that you're continuing people in engaging in self-destructive behavior. What's the counterpoint to that?
Well, my approach to that is, that's like saying, well, why should we keep giving this person free food? They're always needing food. And I know that's a very watered down connection, but the thing is, and with addiction, somebody that's been involved with it professionally and personally, I'm a person in long-term recovery. I truly know that some people don't have an off switch. Some people are dealing with an ocean of trauma, financial difficulties, death, all sorts of, and housing, so many things that can contribute to addiction, if you could. So our approach to that is, like, we still feel that wherever somebody needs help, it's really not up to us to put our outcome or agenda on them. We want to just make sure people are able to move and use and live in safety. So wherever we can provide safety, we do that, and if it's Narcan and pipes and that kind of thing, we do that. If it's clothing, if it's food, we try to do that. You know what I mean? If it's HIV testing, Hep C testing, we try to do that. And then if you can take some of the heavy stuff out of the mix, so to speak, then recovery becomes possible, more possible. And it's interesting because working with a lot of first responders and being somebody that's worked in a lot of very active neighborhoods and skid rows and cities, and that it becomes frustrating for the folks helping folks, because you don't see an immediate outcome. And and from a firefighter's perspective, I mean, I don't think that's what they went to the academy to do, but it seems like the younger firefighters are grabbing it. And I think, and it's a very long answer, but with fentanyl and this overdose crisis, it's sort of like the sacrificial lamb, and it's brought that language into everybody's vocabulary, and it's brought that discussion to everybody's dinner table.
Yeah.
And it's brought that to every health agency's board meetings or whatever, you know what I mean? So
yeah, I mean, I do think
yeah.
that I do think, I mean, most people probably have seen Dope Sick, and actually having a conversation about the origins of addiction. For instance, 44% of people who end up with an opioid addiction began with a prescription medication, right? And so those are kids that broke a leg playing soccer. Those are people who had a root canal even. And asking, and I think the medical profession does have a lot of responsibility in making sure that they're prescribing medications in small numbers, and and asking the question about people's experiences with that and their history. I think we're getting better at that. I think there's still a long way to go. But Jeff, you said something to me when we talked 2 weeks ago that's still in my head. Believe it or not much stays in my head for 2 weeks. But you did talk about this notion of offering up to people who are struggling with addiction the opportunity to realize their own humanity, to realize that these are human beings. That really stuck with me. Firefighters, when they're 6-year-old, want to fight fires, right? There isn't anybody who's 6-year-old who says, oh, I'm looking forward to becoming addicted to a lethal drug and waking up in a ditch, right? Same thing, really. Talk about that, because you're at the coalface of that, right, Jeff?
Well, I think what people who are not in this community or working with this community don't realize that all recovery is a journey.
Mhm.
You know, it's not, we're not one to judge where each individual is at that journey. And unfortunately, they judge them. I've seen them judge themselves way harder than anybody else I've seen on TV or the things that we hear people say. For example, what I had told you is there was this one woman who used to be a nurse who was addicted to heroin, and she had these very distinctive scars on her forearms. And she showed them to me. She goes, "I've lost my license. No one's going to hire me. Look at these arms. They're going to see these arms and know." And I just let her know that that's not the case, because she has more to offer than even I have, who's someone who is not in recovery. She has a certain sense and a certain perspective that I will never have. And that in itself is unmeasurable. And she started crying, saying thank you. And what I had told you, as I found out just a couple of weeks ago, that she just got her, I'm gonna get emotional, she just got her 3 months sober chip. So that
That's-
was,
yeah. I
and
mean,
even today, I was working with somebody today, and she had a recent slip in her recovery after 10 years. She fell back into it for about 5 months. You know, she's in recovery again, but she was knocking herself out saying, "I ruined 10 years, I ruined 10 years." And I was like, "You did not ruin 10 years. You're still in recovery. Just because you took a little slip doesn't mean that you can't, that the entire 10 years that you worked really hard is negated." You know what I mean? You're moving forward. Look where you are now. And I think they do. They just, the people in, a lot of the people in the recovery just don't see themselves as people anymore. They see themselves as garbage and trash.
yeah, well, I mean, every image that they see, you know, I was thinking the other day, actually, there's a show on Max or something, or Prime, called Loudermilk. I don't know if you've seen it, but you know, it's just it's a comedy, and it's a comedy about people struggling with addiction, and it's awful, and but it again sort of underlies or underscores that idea that, you know, people are responsible, people are lesser than. And so no wonder people are taking away from that they are not of worth. And I think that piece of the work is equally important. And Mike, you know, I remember when probably 15, 20 years ago in the mental health world, when we suddenly, it clicked with us that you needed people with lived experience, that you needed people who had taken a journey, and that journey had resulted in recovery and success of a sort. And if you put that into the mix of the treatment paradigm, if you put that into the mix of of how you welcome people into a place, and somebody can see that journey. If you
Sure.
can, Michael, and it may be it may be that you don't want to do this, and that's fine, but talk about how your work has really helped your own journey, that, you know, that what you've done subsequent to your own recovery.
Well, for myself, you know, I worked in public health before I got sober. And, you know, I worked in Northern California, and I worked in various environments like the jail system and the shelter system, some underground needle exchanges. And I brought my voice to that platform, not only to advocate for those populations, but to also, you know, create like a livelihood for myself. And you know, when I reflect back on that, you know, those were the environments that I was familiar with, the language, and you know, coming from, you know, a participant's perspective, but also coming from a healthcare worker's perspective. It was, I think it was very fruitful and able to connect with a lot of different people. And then, you know, 17 years ago, I was finished with my drug and alcohol lifestyle, and I was able to expand that experience and, you know, do things like we're doing right now, you know what I mean? And bring this in, because what I truly know is, you know, a dead addict is not going to make it to treatment. And it's a real simple thing, you know, and you know, some of the resistance we get with these programs is surprisingly enough, from like the sober communities, because we have a lot of older generations and older AA people. And I'm becoming one of those older AA people, by the way.
No, never.
One of those grumpy AA guys. But I think what it is people are starting to understand, like I said, the sacrificial lamb thing I mentioned was like, it's affecting everybody. It's not just like somebody's cousin from the Midwest. It's your neighbors, it's people in the family, it's people at work, it's, your grandkids. It's, I can't even explain like how many grandparents I've worked with who are raising their grandchildren.
Yeah.
You know what I mean? Because either a fatal overdose or somebody's incarcerated or somebody's actually getting the help to get better, so it's a very important position for me to advocate for these populations, but to also, just sort of lead by example. It's the best thing I can possibly do, and I run into a lot of folks down the road years from now. And I think actions sometimes speak louder than words in recovery settings too,
Yeah.
and so we're just open to helping people, move forward, any motion forward, without increasing the risk. If we can help bring some risk down and move somebody forward, we're implementing healthcare.
Right.
Even if we don't realize it at the moment.
Yeah, I think so. Yeah. And I mean, I think at the end of the day, people always remember the people that reached out to them in their darkest hour, when they can look back and said that was the moment that when I first believed, if you like. We have run out of time. I told you this would go quickly. It really did. We still have so many things to talk about. So maybe we can do another section. I always say,
we'd love to come back.
yeah, I always say to people, be careful, don't do so well, because I'll have to ask you back. And you have. Thank you so much. It's been wonderful to speak to you. And this work is about as important as it gets in humanity. So thank you so much. I really appreciate it.
Thank you. And thank you for supporting us.
Absolutely. Goodbye, everybody.